my name is Yoli. I'm your resident occupational therapist here at the Darwin Community Hub based in Pearl Fanny Bay. Welcome to the Southern Cross Care and Continence Forum. You will hear from local Darwin health professionals who will discuss incontinence and offer helpful resources to help you prevent, manage or care for someone living with incontinence. Enjoy.
Hi, my name's Emma and I'm an accredited practicing dietitian from Eat Well Nutrition Service. Today I've been asked to talk to you about fecal incontinence, and I'm going to assume that because you're watching this video, you either experience fecal incontinence yourself or someone you know suffers from fecal incontinence. So I'm hopeful that today's video will give you some information and advice to help seek the best treatment option for you or for your loved one. So fecal incontinence is a term that describes any accidental or involuntary passing of bowel motion, feces or wind from the bowel. For some people, fecal incontinence is a severe chronic condition that requires personal assistance or the use of continence aids to help manage. People commonly perceive incontinence as a normal part of the aging process, and there can be a lot of stigma associated with incontinence. People who suffer from incontinence can experience shame, depression, and a significantly reduced quality of life as a result. Did you know, however, that fewer than 1/3 of people who suffer from incontinence actually seek medical professional help? But did you also know that professional diagnosis and management of incontinence may lead to the identification of a reversible or treatable cause? In many cases, fecal incontinence can be treated through non-drug measures such as diet and exercise, weight loss and lifestyle changes, or through medications. So realistically, the outlook can be pretty bright. Fecal incontinence is a widespread condition that can affect people of all ages, cultures and walks of life. However, it is more common among older people, with both the prevalence and the severity increasing as people get a bit older. Frail older people can experience incontinence more than others because they have additional health issues and medications that they may be on. Bowel control can reduce with age, and conditions such as dementia can affect someone's cognitive ability to recognise the need to go to the toilet. It can affect their ability to locate the toilet and even remembering what to do once they do get there. So it does affect people across all different ages and stages of life, but more commonly, it's going to affect people as they age. Commonly, it can be caused by chronic constipation or diarrhea, and other conditions of the gut and intestine, such as IBS or irritable bowel syndrome, Crohn's disease, ulcerative colitis, celiac disease, diverticular disease. But it can also be commonly caused by intolerances to particular foods and ingredients such as lactose and fructose that are often found in everyday foods. Some commonly used medications can contribute to triggering or worsening an incontinence, and the overuse of things like laxatives can cause the bowel to become a bit lazy, which may lead to long-term bowel management issues. Some of these key dietary related things we'll talk about in a little bit more detail. And it's important that if you think that you may suffer from something like irritable bowel syndrome or a gluten intolerance associated with celiac disease, that you do seek the advice of your GP and an accredited practicing dietitian to really help you navigate through the food choices that may or may not be appropriate for you. The great news is that diet can play an important role in managing your symptoms or even treating incontinence. Some of the key dietary considerations when it comes to bowel health include eating plenty of fibre, keeping well hydrated, and maintaining a healthy body weight. It's well known that fibre plays a vital role in bowel health, and I'd like to explain to you in a little bit more detail how fibre can assist. Fibre in food is classified as either soluble or insoluble. Most plant foods contain a combination of both of these types of fibre. Insoluble fibre in foods such as wheat bran, whole grain breads and cereals will increase the dry volume of the stools and the ability of the bowel motions to hold moisture. Soluble fibre is found in fruits, vegetables and legumes. And soluble fibre dissolves in water, making a gel-like or thickened stool. Soluble fibre can help with both constipation and diarrhoea, as it does help to soften the stool. So together, both of these types of fibre help to create a healthy stool and a healthy bowel. On average, adults require about 25 to 30 grams of fibre per day for bowel health. So how do you know how much fibre is in food? We'll take a look at the nutrition information panel that we've got here. Reading the nutrition information panel on food products can help to guide you to make high fibre food choices. See this wheat bran cereal product? It contains over 12 grams of fibre per serve. Now, to compare the fibre content between two products and to help you choose the one with the most fibre, compare the per 100 grams column on the nutrition information panel of the two products. This will help you to easily identify the product with the highest fibre content. So the general aim for fibre intake in your diet is to have at least 2 serves of fruit and 5 serves of vegetables per day. Make sure you choose high fibre cereals and grains such as whole grain breads. This is a really great way to ensure that your diet is rich in fibre and to help maintain good bowel health. Now that I've told you that you should be having at least a couple of serves of fruit per day, fruit juices are not a suitable substitute as they contain very little fibre, and you should be eating whole fruit and whole vegetables rather than opting for fruit juices. On the other hand, we've also spoken about the importance of dietary fibre from whole grain breads and cereals. And you might recall that I mentioned earlier on that some people can suffer from fecal incontinence as a side effect of an undiagnosed irritable bowel syndrome or food intolerance. Now, seeing an accredited practicing dietitian will be able to help you navigate through the foods that can be or may not be suitable for you to help manage your fecal incontinence, as one of the side effects of an intolerance to food can often be constipation, diarrhoea, and a general bowel discomfort. So it's really important that you can seek advice to help navigate your way through the different food options. The other things to avoid for people that do suffer from fecal incontinence are processed foods such as cakes, pastries, biscuits, and fast foods, as they're generally fairly low in fibre and can exacerbate constipation. Also remember to try and reduce your alcohol and caffeine intake and cigarette smoking, as these can all potentially irritate the gut. Avoid spicy, fatty and greasy foods and artificial sweeteners that go into foods like diet soft drinks, as again, they can cause an excessive bowel motion. Drink plenty of water per day, unless otherwise directed by your doctor. It's important to keep your fluid intake up, as this will help to avoid constipation and help to keep the stools nice and soft. Maintain a healthy body weight and it will help to speak to an accredited practicing dietitian on safe and effective ways to lose weight or maintain a healthy body weight. So in summary, I hope that the information I've provided you with has given you a little bit of guidance in terms of the way that diet can help to maintain good bowel health. I'd really encourage you and your loved ones to go and seek the advice of a GP and an accredited practicing dietitian to really help you navigate through the options and to be able to discuss the way that you can optimise your bowel health and reduce the impact of fecal incontinence on your lifestyle. Hi, my name's Emma and I'm an accredited practicing dietitian from Eat Well Nutrition Service. And today I'm going to talk to you a bit about urinary incontinence. Now, I'm going to assume that you're watching this video because you suffer from urinary incontinence or one of your loved ones suffers from urinary incontinence and you'd like a little bit more information on the treatment options and how diet can potentially improve urinary incontinence. So what is urinary incontinence? Well, it's actually just an involuntary leakage of urine from the bladder, and it is a widespread condition that can affect people from all ages, cultures and walks of life. It does appear to affect women more so than men and does become more common as we age. In many cases, urinary incontinence can be treated through lifestyle changes such as diet exercise, weight control, or through medical treatments. For some people, urinary incontinence is a severe chronic condition that requires them to seek assistance with toileting or continence aids to help manage. And subsequently, urinary incontinence can have a major effect on a person's physical and emotional well-being. As I've mentioned, as we get older, changes to our body can make it more difficult to maintain proper bladder control, which is why urinary incontinence can actually become more prevalent as we age. The bladder can become smaller and it doesn't contract as efficiently to empty. It may also become more sensitive and may become harder for people to actually hold on. Urinary incontinence is also commonly linked to pregnancy, childbirth, and menopause. Being overweight or obese may increase the risk of urinary incontinence, and this is because the excess body weight that a person carries can put additional strain on the pelvic floor muscles, which can lead to bladder issues. Other risk factors that tend to become more common as we age are experiencing things like urinary tract infections, enlarged prostate in men, or other health conditions such as stroke, dementia, or Parkinson's disease, which can make the process of actually going to the toilet more difficult, and therefore the likelihood of being urinary incontinent may increase as a result. So how does diet impact on urinary incontinence? Well, firstly, contrary to popular belief, maintaining adequate hydration is important for the management of urinary incontinence. And this is because dehydration is linked to constipation, which can increase the pressure on the pelvic floor muscles and lead to involuntary bladder leakage. So it's important to drink 6 to 8 glasses of fluids per day, unless otherwise directed by your doctor. But you might like to consider spreading your fluid intake across the day and having smaller, more frequent sips of fluid throughout the day, rather than drinking all at once. Maybe aim for 1 to 2 glasses of fluid with each meal or snack that you have during the day to ensure that you stay well hydrated. Depending on when you experience urinary incontinence throughout the day, it may be really important to limit fluid intake in the afternoon or evening if you suffer from incontinence during the nighttime while you're asleep. Avoid soft drinks and alcohol and drinks with caffeine, as these can often irritate the bladder, and maybe try herbal tea instead. But remember, do not reduce your fluid intake, as this can concentrate the urine and irritate the bladder and make the urinary incontinence worse than it should be. Be sure to eat plenty of fibre. The reason for this is to reduce your risk of constipation, which can exacerbate urinary incontinence and make your symptoms worse. So let's talk a bit more about fibre in your diet and how to make sure you're getting enough. Fibre in food is classified as either soluble or insoluble. Most plant foods contain a combination of both of these types of fibre. Insoluble fibre in foods such as wheat bran, whole grain breads and cereals will increase the dry volume of the stools and the ability of the bowel motions to hold moisture. Soluble fibre is found in fruits, vegetables and legumes. And soluble fibre dissolves in water, making a gel-like or thickened stool. Soluble fibre can help with both constipation and diarrhea, as it does help to soften the stool. So together, both of these types of fibre help to create a healthy stool and a healthy bowel. On average, adults require about 25 to 30 grams of fibre per day for bowel health. So how do you know how much fibre is in food? We'll take a look at the nutrition information panel that we've got here. Reading the nutrition information panel on food products can help to guide you to make high fibre food choices. See this wheat bran cereal product? It contains over 12 grams of fibre per serve. Now, to compare the fibre content between two products and to help you choose the one with the most fibre, compare the per 100 grams column on the nutrition information panel of the two products. This will help you to easily identify the product with the highest fibre content. So the general aim for fibre intake in your diet is to have at least 2 serves of fruit and 5 serves of vegetables per day. Make sure you choose high fibre cereals and grains such as whole grain breads. This is a really great way to ensure that your diet is rich in fibre and to help maintain good bowel health. It's also really important to maintain a healthy body weight. This helps to reduce unnecessary weight through the pelvic floor and strain on the bladder, which, as we know, can worsen bladder leakage. I'd encourage you to go and speak to an accredited practicing dietitian for support and advice about the best way to modify your diet to achieve an appropriate body weight. In summary, there are some key diet and nutrition strategies that you can use if you do experience urinary incontinence. So I would encourage you to go and speak with your GP or medical professional and seek the advice of an accredited practicing dietitian that can really help to support you and guide you through your diet choices and make the necessary changes to help improve the symptoms of urinary incontinence. The medical professionals are there to help, and I'm sure you will achieve some really great outcomes with their support and advice.
Hello and welcome. My name is Paige Shreeve. I am a physiotherapist and I'm the owner and director at NT Physiotherapy in Casuarina in Darwin. I've been working as a physiotherapist for over 20 years, and for the last 7 years I've been working as a pelvic floor physiotherapist. So specialising in treating issues to do with the pelvic floor, such as incontinence, prolapse, and pelvic pain. So this area of physiotherapy is sometimes known as pelvic floor physiotherapy or women's health or men's health physiotherapy. In 2007, I was nominated for the Northern Territory Allied Health Professional of the Year for my work in the area of pelvic floor and continence in women in Darwin. It's really an area of passion for me, so I'm super excited to be able to share with you a little bit of my knowledge today about pelvic floor and how it relates to continence. I'm feeling a little sad I didn't get to meet and chat to you in person, but I really hope that you can get some good information from this online video. So before we start really delving into the area of incontinence, it's quite important, I think, to understand firstly, how does the bladder work normally and what's the importance of the pelvic floor muscles? So a little bit of basic anatomy, first of all. The bladder is a small muscular organ. When there's no urine, it can be about the size of the fist, and it sits at the front of the pelvis, just behind the pubic bone that you can touch at the front of the pelvis. Because it's a hollow muscular organ, as we drink water through the day or take in other liquids through the day, and our bodies create urine, the urine is stored in the bladder, and the bladder can slowly expand. Because it's muscular, it stays relaxed and it slowly expands as it fills with urine. And as it slowly expands, we have this gradually increasing feeling of needing to go to the toilet. So when there's about 50 mils in the bladder, which is just a couple of tablespoons worth of urine, there's a little feeling like we need to go to the toilet, a very, very mild feeling of needing to go. Once we get up to about 200 mils of urine, so that's sort of like a glass worth of urine inside the bladder, that's when we should be getting more of a moderate urge to go to the toilet. So we might think, oh yeah, there's something in the bladder, I could go to the toilet, but I don't really need to just yet. I could hold on for a bit longer. I'm just going to finish what I'm doing, and maybe in the next, half an hour, I might go to the toilet. And then once we get up to about half a litre of urine in the bladder, that's when we should be getting a strong urge and thinking, okay, I've got a full bladder, I need to go to the toilet, I don't feel like it's urgent, I don't think I'm going to leak, but I'm going to go to the toilet in the next 5 minutes and I'm going to empty my bladder of urine because it's full. So there's this gradually increasing feeling of the bladder filling and the need to go to the toilet, the urge to go to the toilet. But whilst the bladder's filling, and before we decide that we're going to go to the toilet and empty the bladder, it's the pelvic floor muscles that keep us continent and stop us from having a leak. So the pelvic floor muscles are what us physiotherapists call core muscles. And that means that they can contract even when we're not thinking about it. And in the case of our pelvic floor muscles, they can contract to keep us continent without us even having to think about it. It's automatic. So the pelvic floor muscles will contract as the bladder's filling with urine. And the first thing is that as the pelvic floor muscles are contracting, it's like turning off the tap to the bladder. So it squeezes the tube from the bladder, the urethra, squeezes that shut. So if we're nice and strong, not a single drop of urine can come out. The second thing that they do is by contracting, it sends a message via the nerves to the bladder, telling the bladder, you have to stay relaxed. You have to just keep relaxed and you have to keep expanding. It's not your turn yet to go to the toilet. We're not ready yet. You just stay where you are and keep holding. So two things. The pelvic floor muscles shuts the tube so we can't leak. The second thing is it tells the bladder we're not ready yet, keep holding. So the pelvic floor muscles should be in control of the bladder. Pelvic floor muscles are the boss. Okay, so when we decide we're going to go to the toilet, and we calmly walk to the toilet, sit down, we've done our toilet training as a toddler. So our body already knows that when we sit down on the toilet, that it's time for those pelvic floor muscles to then relax. And then when the pelvic floor muscles relax, there's no longer the contraction holding the tap off, so the urine can come out. But secondly, when the pelvic floor muscles are not squeezing, there's no message going to the bladder to say, hold on. So the bladder knows, okay, the pelvic floor muscles have relaxed. It's now my time to squeeze and let the urine out. So when the pelvic floor muscles are relaxed, the bladder can be the one in control and the urine is able to come out. So we know those pelvic floor muscles are core muscles and work automatically, but of course they are also under voluntary control. So if we need a little bit more strength in holding on, say for example we're really busting to go to the toilet, or if we've had to wait a while, then we can use our pelvic floor muscles voluntarily to give some extra squeeze. And that will ensure, number one, the tap's turned off and the bladder cannot leak because the urethra is held shut. Secondly, it gives more of a message to the bladder to say, I'm in control, you're not in control, you have to stay relaxed. So it's quite important that we do have pelvic floor muscle strength enough that we can keep control of our bladder, prevent a leak, and remain confident that we're going to be dry. There's also times we might need to hold on with that pelvic floor squeeze. Say we need to go to the toilet and we're waiting in line. We might have to wait a few minutes. You know, sometimes we need to hold a pelvic floor contraction for a few minutes. Or we might be out walking and we need to go to the toilet. In that case, we've got to hold on for a few minutes, even whilst we're walking. So we need to have some strength in the pelvic floor. We also need to have some coordination and some endurance. So they're all the things that are important in making sure that your pelvic floor muscles are nice and strong. So let's look a little bit more at the pelvic floor muscles. Where are they in our body and how do they work? I'm holding up, here is a model of what our pelvis bones look like. So at the front, this is the pubic bone that you can touch at the front of your pelvis. And looking inside the pelvis, here at the back, this is the very bottom of your tailbone. The sacrum, and then the lumbar spine comes up. The pelvic floor muscles attach from the inside of that pubic bone to the coccyx here, like that. Like a sheet of muscle across the base of the pelvis, like that. But of course, the anus, the vagina, and the urethral sphincter also pass through there too. So the pelvic floor muscles are actually more like a hammock with a hole in the middle where those three tubes come. When we contract the pelvic floor muscles, the first thing that happens as the muscle fibers shorten is that we get a squeezing off of all those passages that are sitting there in the middle. So there's a squeeze action, and then as we keep contracting our pelvic floor, we get a sort of lifting up on the inside sort of feeling. So first of all, the muscles squeeze together and then lift up inwards. So you can think about it a little bit like this analogy. If I'm holding onto a pebble and I drop the pebble into a puddle of water, firstly you see the pebble drops, it hits the water, and then you see these ripples gently going out on the water. Now let's hit rewind on that little video and imagine you're seeing the ripples coming back in, and that's a little bit like the squeezing together, ripples coming in. Secondly, imagine then that pebble coming back up in slow motion. So ripples come together and then pebble comes up in slow motion. So that's a little bit like the squeeze together, lifting up. The pebble coming up is like the lifting up feeling that you get when you do a really strong pelvic floor contraction. So some people can feel that they're getting a little bit of a squeeze. Some people can feel they're getting a really strong squeeze, but they can't feel any lift feeling. And other people can feel that they're getting a good strong squeeze and they can feel a good lift up feeling as well. The stronger you are, the more you'll feel a good squeeze and a good lift. So that's what we're aiming for with a pelvic floor contraction. So how do you know if you're using the right muscles? Let's try it together. So sitting in your chair, I want you to sit very upright so that the perineum, which is the area of the body between your legs and between where, if you're a man, the penis and testicles sit, and the anus, that's the perineum, or if you're a woman, between where the urethral opening is and the anus, that's the perineum area, or the gusset area. So you're sitting tall, so that area is contacting with your chair, and you're sitting really tall. if you imagine the ripples coming in and the pebble coming up, you're imagining a squeeze coming in around the vagina and the anus area, or for men around, it might feel like you're lifting the scrotum and squeezing around the anus. So for women, squeeze around the vagina and anus and lifting up off the chair. For men, are feeling like you're squeezing the same area. It might feel like you're lifting up the testicles, and the anus is also squeezing and lifting up, feeling at the perineum. When you do that, can you feel a squeeze? Can you feel a lift? Congratulations if you can feel the lift, because you are probably stronger than most. But it can always be worked on and strengthened. So what's also important is not only how strong you are and how much you can lift, but secondly, can you hold that contraction for a period of time? Can you breathe with it and hold it for a number of seconds? You know, even up to 10 seconds? That's your endurance. So let's try it together. I'll tell you when to try your squeeze and lift, and then I'm going to count. And I'll count up to 10. If you can hold a squeeze and a lift up to the count of 10, that's fabulous. That's very good. Or you might find that once I get to 3, you're starting to lose it. Or maybe you can get to 7 before you start to lose it. Just monitor yourself, and as I count, just see how long you can hold and feel that squeeze or feel a good squeeze and lift. When you're starting to feel like you're losing it, just take note of the number, and that will be your number. Okay, so remembering that in a moment, you're going to try to feel that squeeze and lift, thinking of ripples coming in around the vagina, and then the pebble coming up is like the lifting up of the perineum up off the seat. And ready, and go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and let go. Let go, let the pebble come down, let the ripples go out. Relax that whole pelvic area and take a breath. So what was your number? That's how long you can hold a contraction. The next thing, if we're looking at strengthening our pelvic floor, we're also going to look at how many of those contractions can you do in one session. You're allowed to have a good rest in between each one. It's good to take at least 20 to 30 seconds to just completely relax. You might think of the pebble coming down, the ripples going out. Let that whole pelvic area settle and relax. You might take a few deep breaths and allow 20 or 30 seconds to go past. And then let's try another attempt. So let's try it again. Some people find that the first attempt is not their best. Some people find the second or third attempt is their best because things warm up and you're getting used to it. So we might try it a couple of times. So again, sitting in your chair, sitting really upright, so that gusset area, the perineum is sitting onto the chair, and you can feel that you're trying to squeeze and lift that area up off the chair. Thinking of the ripples coming in around the vagina, and then the pebble coming up and lifting up on the inside. For men, you're thinking it's a squeezing action. You might then feel a feeling like you're lifting the testicles, but also for both men and women, you might feel a squeezing, tightening around the anus as well, because all those muscles work together. We're not going to try and separate the front or the back. What's most important is that you can get a good squeeze and a good lift. So we do them all together. So let's try again. Are you ready? And go. Squeeze and lift. 2, 3, 4, 5, 6, 7, 8, 9, 10. Let go. Let the pebble come down. Let the ripples go out. How did you go? Did you get to the same number? Did you do better? Or maybe not as strong? You can figure out your own individual exercise prescription by repeating this, maybe in your own time, repeating this. So for example, if you could get a good squeeze that you could feel for 3 seconds, and then you rest for at least 20 to 30, you might find that you can do that 5 times, for example, before you start to get tired and you can't do another one. That's a really good place to start as a daily exercise to keep your pelvic floor muscles really strong. So each day, once a day, you'll do that squeeze, and then you'll do that 5 times. Or you might have found that you could hold a 7-second contraction and you could feel a good squeeze and lift. But because you're holding it longer, you might have felt, I can only do this 4 times before I start to get tired and I can't do it again. Your exercise prescription would be hold a 7-second contraction and then have your good 20-30 seconds rest, and then do that 4 times. So you start, whatever level you're at, once a day, any time of the day where you can have a few minutes uninterrupted and you can really focus on this. You can also do this in any position. So you might try it lying down or in a recliner, or you might find you can feel it better if you do it sitting upright in a chair or even standing. It's worthwhile trying in different positions. Some people feel it's easier lying down. Other people find that they can feel more happening when they stand because the muscles then have to lift against gravity. So pick your level and exercise just once in the day, and then have the rest of the day and let those muscles recover. A bit like if you were going to the gym. You don't go to the gym 20 times a day. You work hard once and then you rest and let the muscles recover. And you'll be able to slowly progress. So for those people that could do a 3-second contraction, you might find after a week or so that actually that's getting easier. You can do your 3-second contraction 5 times and it's easy. So once it gets easy, try a 4-second contraction. Give that a week or 2 and see how you go. Once that gets easy, try 5. Keep progressing it. If you were the person that could do a 7-second contraction, but you could only do it 4 times, do your 7, and then when it feels easy, then do 8 seconds. When it feels easy, do 9. And what ultimately would be a really good level to get to is if you can do 10-second contraction, have a rest, and you can do that 10 times. We know that you've got good strength, you're going to have some good endurance, so you'll be able to do this if you're busting and you've got to hold on a bit to go to the toilet. You're going to be nice and strong. And for some people, that might take a couple of weeks to get there. For other people, it might take a few months to get there. It doesn't matter. But start where you're at, slowly progress how long you can hold the contraction. And then secondly, progress how many contractions you can do. If you don't feel that you're really getting anything happening there, if you can't feel a contraction, it could be a really great idea to come and see a pelvic floor physio for a little bit of extra help. There's lots of different exercises and treatments and techniques for helping to get a good pelvic floor contraction that you can feel. So we're aiming for a good, strong feeling of squeeze and lift. We're aiming to be able to hold it for 10 seconds or so, and to be able to do several of them. And then you'll know you've got really good control and strength of the pelvic floor. So it's really worthwhile doing these exercises just once a day. It'll take you 5 minutes, and it can help you to feel really confident that you've got strong pelvic floor muscles and able to keep control of your bladder and stay dry. Remembering that we just want to do this exercise session once a day, and then we want to give the muscles a bit of time then to rest and recover and grow some strength before we work out again. And if you're having any difficulty with any of that process, you could always come see myself or see a women's health or a men's health physiotherapist to get some help. But that gives you a bit of an idea of how the bladder functions normally and how important the pelvic floor muscles are in keeping control of the bladder.
So hello again, welcome back. My name's Paige Shreeve, and I am a pelvic floor physiotherapist. And in this second talk in the series, we're going to be talking about urinary incontinence. So incontinence is when there's an involuntary leakage of either urine or feces. But in this talk, we're going to be focusing on urinary incontinence, so leakage from the bladder. We know that leakage of urine affects a large percentage of women and men as well. And we also know that there's 2 different types of urinary incontinence. So we're going to talk about both of the different types, what causes it, and what can we do about it. So the first type of urinary incontinence that I'd like to talk about is called urge incontinence. And this is when it's associated with having a desire or an urge to go to the toilet to empty the bladder, but there's a leakage because either you don't quite make it in time and there's a leak, or maybe the urge to go is so strong that it's impossible to hold and the bladder just empties itself. So it's called urge incontinence. To understand how it works, let's just go back and revisit what I talked about in the last talk about normal bladder function. So we know that normally the bladder slowly fills with urine and expands, and the bladder muscle slowly relaxes and expands and stretches as the bladder fills. And we normally are not at risk of having a leak because the pelvic floor muscles underneath are holding the urethra shut, like keeping the tap turned off, so the leak can't come through the urethra. And the second thing that the pelvic floor squeezing or tone does, it sends a message back to the bladder to say, stay relaxed. It's not your turn to squeeze yet. Stay relaxed. I'm in control. We're not at the toilet yet. And so normally the pelvic floor muscles are in control of our bladder. And as our bladder slowly fills with urine, we have a gradually increasing feeling of needing to go. So that when we decide to go to the toilet, we can calmly walk to the toilet and we sit down, if we're a lady, and the pelvic floor muscles know to automatically relax off. We don't even have to think about that because we've done our toilet training as a toddler. So the pelvic floor muscles relax, and that means the tap is open. Urine can flow out,
There's nothing stopping it. And there's no message now going to the bladder to say, stay relaxed, hold on. And so the bladder goes, oh, it's my time. I'm going to squeeze, and out comes the urine. So the pelvic floor muscles say to the bladder when we're not allowed to go, and the pelvic floor muscles say to the bladder when you are allowed to go. So the pelvic floor muscles normally should be the boss. With urge incontinence, though, it's the bladder wants to take the role of being the boss. The bladder's being a bit naughty here. And sometimes what it will do is want to squeeze or contract when it shouldn't, when we're not even at the toilet yet, we're not ready. So it's squeezing and trying to empty itself at completely the wrong time. But the bladder's strong, so it's very, very difficult to hold strongly and avoid a leak when your bladder's trying to empty. It's a very powerful thing, and it feels like a really strong need to go to the toilet. Sometimes it can come on really, really suddenly. So a minute ago, I didn't feel like I needed to go to the toilet at all. And now suddenly I'm busting to go to the toilet. It's not that the bladder has suddenly filled up. It's that the bladder is trying to squeeze the urine out, but we're not ready for it. So it's a really strong feeling. Oh, I got to hold on and really need to go to the toilet. And often the pelvic floor muscles can't hold against that strength when the bladder's doing the wrong thing. We call this an overactive bladder, or we say that the bladder is having a spasm, bladder spasm. And that's what gives you that sudden urge, really strong urge, desperate need to go to the toilet, and what can cause the leak. So I'm running to the toilet, but I might not make it in time, or I just can't control it at all and it's gushing down my leg. So that's urge incontinence. So having that bladder spasm or overactive bladder is not normal, but it is actually relatively common. I see a lot of women at my clinic who come in complaining of this overactive bladder and the sudden, really strong need to go to the toilet, often with leakage. It's quite common. Luckily, it's very treatable. So what causes it? There's two major things that can cause it. The first thing is maybe for some reason your bladder wants to empty because the urine that's sitting inside your bladder is somehow irritating to the bladder. A really common cause that I see up here in Darwin is if we are a little bit dehydrated. So if we've not been drinking enough, particularly drinking water, if we're not drinking enough water and we get dehydrated and our urine then becomes quite yellow, strongly coloured, even brownish, and it can smell a bit stronger, then we're getting dehydrated. The urine should be more clear or straw coloured, and not quite so strongly smelling. In Darwin, we probably need to drink more water than what is recommended for the states down south, for example. So normally you might hear people say you should have 1.5 to 2 litres of water. It can actually be more than that in Darwin. If you are sweating or if you're in aircon all the time, you can lose a lot of bodily fluid through sweat, and you can get quite dehydrated. So sometimes in Darwin you need more like 2.5 to 3 litres sometimes, depending on your activity, depending on how much you sweat. But a good idea is to have a look when you do pass urine and see, is it clear or just lightly straw coloured, or is it getting yellow? Because you probably need to drink more water if it's getting yellow. Some medications and some vitamin supplements and things like that can make a difference to the colour of the urine. So, take that into consideration and maybe ask somebody if you're a bit concerned that your urine's too dark. But aiming for a good amount of water is important. When that urine is really concentrated because you're dehydrated, the urine that's sitting inside the bladder can actually be irritating to the inner lining of the bladder. It can cause the bladder to become inflamed, and it can also cause urinary tract infections as well. So the bladder wants to protect itself. It wants that irritating strong urine out quickly. So that can often cause the spasms to happen. So make sure you're getting lots of water, and you may find that you have better control of your bladder. And that might sound a bit ironic, because a lot of people come to see me and they say, I've limited how much water I drink because I don't want to leak. When in actual fact, if you're drinking more water, the bladder is less likely to be irritated and have a bladder spasm. You're much more likely to have a good control over your bladder and even go to the toilet less often if you're well hydrated. Another thing that can irritate the inner lining of the bladder is caffeine. This doesn't affect everybody, but a certain percentage of people find that caffeine, again, can be really irritating to the inner lining of the bladder. So some people know that when they have a coffee, 20 minutes or half an hour later, they're going to get a strong need to go to the toilet and get that caffeine out of the bladder. Caffeine is also in black tea. That includes if you have milk with it, but tea, green tea is also made from the tea plant and has caffeine. And so does white tea. If you've ever heard of white tea, that also comes from the tea plant. There's also caffeine in chocolate and cacao from the chocolate bean. And there's also caffeine added into energy drinks and things like Coca-Cola, but also energy drinks like Red Bull, that sort of thing, have caffeine in as well. So all of those can irritate the bladder for some people. And another one is artificial sweeteners. They can really be very irritating to the bladder and really cause a lot of bladder spasms and leakage. If you are diabetic or pre-diabetic, you may be using artificial sweeteners such as NutraSweet or Equal, and diet drinks like Diet Coke also have artificial sweetener in them, and that can really cause problems with urge incontinence. However, if you are diabetic or pre-diabetic, it could be a good idea to avoid the artificial sweeteners, but it's not good to just replace it with sugar, because that's not good for the diabetes. So you may have to work on slowly adjusting to having less of a sweet tooth, unfortunately. So have a think about those three things if you know that you get some urgency, strong desire to go to the toilet, or urge incontinence. More water, potentially less caffeine, and less or avoiding artificial sweeteners. There's another way that the bladder can become accustomed to having a spasm when it's not appropriate, and that's if we've slowly trained it to do that. So a lot of women may remember when they were little girls, this is really common, that your mother might say, we're going off shopping. Do you need to go to the toilet just in case? If you train yourself to go to the toilet when you don't really need to, you're training your bladder to not be able to hold on. And so if you get a little bit of urine in the bladder, out of habit, it'll just want to get it out because it's never been trained to hold a larger amount. So going to the toilet just in case is not a good idea. It's much better for the health of your bladder to only go to the toilet when you have a need to go, a strong need. If you think you can easily hold on for another half an hour, it's a good idea to try and hold a bit longer, because you're practicing making the bladder stay relaxed. And you are also practicing getting the pelvic floor muscles to hold strongly. So you're keeping your bladder and your pelvic floor fit by holding on when you can. Some women find that there's certain triggers that will make them have a bladder spasm or that sudden urge to go. A common one is hearing the sound of water, maybe the sound of the shower being turned on. For some reason, the sound of the water gets equated with, oh, I'm in the bathroom, I've turned the shower on, I'm just got to quickly go to the toilet before I jump in the shower. So your brain and your bladder start to learn when the water goes on, the bladder empties. And so even if there's nothing in the bladder, even if you don't even need to go, you turn the shower on and you go, oh, I need to go, because your bladder has that spasm. Another common one is if you arrive home from being out and you're pulling up in the driveway and you get the need to go, or maybe you're fishing for your keys to unlock the door, or you're stepping out of the taxi, or you're stepping off the bus and you've arrived back home and suddenly you need to go where a minute ago you didn't need to. Again, it's not like your bladder has suddenly filled up. It doesn't happen quickly like that. Your bladder is having a spasm, and it may not be that there's even that much urine in your bladder, but it feels like you need to go. This has become a habit. It's become a trained thing. And if you always let your bladder have the control and you don't practice using your pelvic floor muscles to control it, the bladder will always win and it will actually get weaker. So what do we do when the bladder is having this spasm and we're having this urgent need to go to the toilet, and we may also know that, oh, we're going to have a leakage because it's happened before? Well, we use our pelvic floor muscles. We squeeze them as hard as we can. Because remember, when we squeeze the pelvic floor muscles, remember what it does is it sends the message to the bladder to say, don't squeeze, stay relaxed, stay relaxed. And so when you get that bladder spasm, if you squeeze your pelvic floor really strongly, it will send the message to the bladder and say, no, bladder, relax. And the second benefit is, well, you're giving extra closing pressure. So if anything was going to trickle out, you're providing the maximum squeeze to shut the tap and make sure you don't leak. So 2 reasons why the pelvic floor works. But it actually stops the bladder from having that spasm. Now, we call it bladder retraining, when we're training our bladder to hold on and not have those spasms. Pelvic floor physios call it bladder training or retraining. And it's a little bit like training a little puppy. You need to be very patient with the process and patient with yourself. It's true that it might take a few days before you start to feel, oh, my bladder's responding. I don't think I'm desperate to go to the toilet so much. You regain control, you minimize the leaking, and after a while, the bladder will then listen to you and listen to the pelvic floor. You will regain being the boss, and the pelvic floor muscles will regain being the boss. But you do have to be diligent. Bit of practice and a little bit of time, but you'll get there. So I see many, many women come into my clinic who have leakage with urge incontinence. When they start practicing using the pelvic floor, within a couple of weeks, there's a big difference. And most women can completely stop the leakage. Now, obviously, the stronger your pelvic floor muscles are, the more effective this technique is going to be. So remember in the first talk we talked about doing your daily exercise to keep yourself strong? That's really important for this technique to be as effective as possible. So remember, if you get that sudden out of the blue, really strong need to go to the toilet and you're scared you're going to have a leakage, best thing to do is just stop what you're doing, do a strong pelvic floor contraction. Strong as you can. You might need to hold it for a few seconds and you may need to do it a couple of times, but often you can get that bladder to calm down, and very often then the feeling of needing to go to the toilet really calms down or even completely goes away. And then you can be in a more calm, confident place to then reassess. That was a strong urge to go, but now it's settled down. Do I still need to go to the toilet or not? And you may decide, yeah, I think I will go to the toilet, and you can calmly walk to the toilet with less risk of leaking. Or you may decide, actually, I don't really need to go that strongly at all. I could hold on a bit longer. So you have regained your control over your bladder in that way. And the second type of urinary incontinence is called stress urinary incontinence or stress incontinence. You might have heard that term. So in this case, the word stress refers to some kind of physical pressure that's on our body. That physical pressure might be a cough or a sneeze or a laugh or lifting something. It might be doing a little run or a jump, hop or a skip, or it may simply be getting out of bed or getting out of a chair. And that slight increase in pressure on the body also puts an extra pressure onto the bladder. And if the pelvic floor muscles are not squeezing with enough strength to keep the urethra shut, keep the tap closed off, that increase in pressure coming from the cough or the sneeze or the lift puts enough pressure on the bladder that urine gets pushed out through the urethra. So when we're doing these activities, we know there's going to be a bit of increase in pressure on our body, but we can also decide voluntarily, I'm going to get out of my chair or I'm going to lift my bag. I might need a little bit of extra pelvic floor closing pressure so I don't leak. And you can decide to do a pelvic floor squeeze. The stronger the squeeze, the more effective it's going to be at reducing any leakage. And remember, you may have to hold it for a few seconds. And sometimes you've got to get there really fast. Sometimes you don't get a lot of notice with a cough or a sneeze. So you've got to get that pelvic floor on quickly. You've got to have good coordination. If you're carrying a bag, for any distance, you might have to hold the pelvic floor on for a bit of time. So having an effective pelvic floor contraction will mean, making sure that you do your daily exercises so you're nice and strong. And we call it doing the knack. When you do a voluntary, conscious pelvic floor squeeze, when you know that you're going to cough or sneeze or laugh or lift or make some movement that might cause a leakage, like getting out of the bed, getting out of the chair, or a little jump, or stepping up onto a curb sometimes can do it. do the pelvic floor squeeze at the same time. So you're providing extra closing pressure so nothing can get pushed out. So that's called the knack. I don't know why it's called the knack, but that's what pelvic floor physiotherapists call it. A voluntary pelvic floor squeeze to stop yourself leaking when you do certain activities. Welcome to the third talk in our little series on the pelvic floor and continence. In this third talk, we're going to talk about something a little different, but it's very related. We're going to be talking about pelvic organ prolapse. This can affect both men and women, but the statistics are that a lot more women than men can suffer prolapse, largely because of the fact that we have children and the pressures involved on our bodies through that. But the information can also be good for you men that are watching as well, but definitely important for all you ladies watching. So this is important when it comes to continence, because sometimes I see ladies at the clinic here who have very strong pelvic floor muscles. They're very, very good at switching on the pelvic floor muscles when they want to, and they might be able to hold it really well and get a good lift. They can do the knack really well, but they still get a leakage. Why is that? There is definitely an explanation for this, and this is why I feel it's important to talk a little bit about what is pelvic organ prolapse. So in our pelvis, we have, here is a model of the pelvis again, looking from the front. And if we look from the inside view, at the front of the pelvis here, we have the bladder and the urethra. Sitting just a little bit behind and on top of that is the uterus, and then the vagina coming down. And then in the back against the sacrum is where the rectum comes down to the anus. So the anus, the vagina, and then the urethra at the front. And those three pelvic organs, the bladder, the uterus, and the rectum, are all held suspended up in the right position with lots of ligaments and connective tissue, and often we call that connective tissue fascia. So the ligaments and the fascia hold the pelvic organ suspended upwards in a correct anatomical position. However, over the course of our whole life, there can be a lot of downwards pressures on our body that can cause the ligaments and the fascia, connective tissue, to slowly become stretched. And if that connective tissue stretches, the organs will want to sit a little lower than what they did before. It's just gravity. When the organs are sitting lower in the pelvis than what they should be, that's called prolapse. So it might be that the connective tissue holding up the bladder is stretched, and the bladder is the organ that starts to sink down. Or it may be the ligaments and their fascia holding up the uterus gives way and stretches. So the uterus is the the organ that starts to sit lower. Or it may be the rectum. Could be the fascia holding the rectum up that gives, and so the rectum starts to droop a little down. The bladder and the rectum can't fall out, but they can bulge against the front wall or the back wall of the vagina. The uterus itself can actually come out. So sometimes women come to my clinic and they say, I can feel a dragging, heavy, sort of uncomfortable feeling at my perineum or around the vagina. Some women say, I can feel a lump there at the front or the back of the vagina or inside the vagina that wasn't there before. Some women get low back ache because the fascia and ligaments attach to the lower back. So if there's that pulling, dragging, you can get backache. Some women say that when they first wake up in the morning, it feels normal, but if they've had a big day on their feet, or if they've been coughing or sneezing a lot, or lifting a lot, then they can feel it and it gets worse by the end of the day. Some women say a lie down in the middle of the day makes it feel a little bit better, but then it gets worse again by the evening. These are all symptoms of what we call prolapse. So any force that's a downwards kind of force on the body can add up over the years of our life to stretch the ligaments and the connective tissue. So for women, childbirth is probably the biggest downwards stretching force that there is. The more children that you have, the more risk that you might get prolapse. The bigger your children are, the heavier they are, the more risk of prolapse. If the obstetrician used forceps to pull the baby out, there's more drag that can be a risk factor for prolapse. Women who are overweight or obese are carrying around a lot more weight. There's a lot more downwards pressure all the time. That's a big risk factor for prolapse. If you cough or you sneeze a lot, that can cause a lot of downwards pressure. A cough or a sneeze can only take, a second, but there's some big pressures involved, enough that we might leak out of our bladder. Remember, we talked about that in the last talk. Also enough that if we do it a lot, we can start to develop prolapse. Or it could be if we're lifting too much or we lift something heavy. Constipation is another big one. If we're dehydrated or if we're not eating enough fiber in our diet and our stool starts to become hard and takes a bit of straining to get it out, that can definitely cause prolapse. And it can be any one of those factors or a combination of those factors that can cause prolapse. A mild prolapse, some women may not even feel anything going on there, but it can be assessed by a pelvic floor physiotherapist or your doctor or a gynecologist. And a mild prolapse we call a grade 1. If the prolapse has got severe that it's protruding and obviously can see it from the outside, it might be a grade 3 or a grade 4. So we grade prolapse out of 4, grade 1 being minor, grade 4 being, more major. Now, prolapse is not a life-threatening problem. Many women deal with prolapse and never choose to have any treatment or any surgery, for example. There are treatments in physiotherapy that are non-surgical that can be very effective. But one thing that having a prolapse can affect is your continence. We're going to focus here on bladder continence, urinary continence. So if there is a prolapse of the bladder or of the uterus, it can cause a difficulty in even the most strong pelvic floor muscles being able to actually effectively close off the urethra. That's because the urethra is sitting lower in a different position than what it normally would be. So normally, if my finger is the urethral tube and these are the pelvic floor muscles, Actually, they sort of squeeze this way. Imagine if the urethra is in a different position, it might be a little bit sort of kinked and a little bit sloppy because it's sitting a bit lower, it's lagging a little. It's much harder for those pelvic floor muscles to get a really good closing pressure, even if they're really, really strong. So if you know you have strong pelvic floor muscles, you can feel them working well, but you still have a leak even though you're doing the NAC. It might be that there's prolapse. And if you get the prolapse treated, it can really help you stay dry. Or it may be that you don't have such an issue with leakage, but you have a problem with prolapse. There's an uncomfortable, heavy, dragging feeling, or there's a lump that wasn't there before that's now there that's causing you discomfort. So either of one of those things are treatable. But we know that prevention is always so much better than cure. So remember when I talked about stress incontinence, when there's a pressure on your body that causes the bladder to want to cause a leakage, what we do, we squeeze our pelvic floor muscles voluntarily against that. So if we cough or we sneeze or we laugh or we lift or we run or skip or jump, we can do a pelvic floor contraction to make sure we don't leak. And it's called the NAC. Well, if you have a really good NAC and you can get a good squeeze and you can get a good lifting up feeling, the lifting up of your pelvic floor muscles can provide that uplift against the downwards forces of a cough or a sneeze or a laugh, or even, repetitive lifting of something, even just a couple of kilos or 5 kilos. If you're lifting that a lot, it can cause prolapse. So if you squeeze your pelvic floor every time that you are lifting something, or cough or sneeze, you're doing the NAC and you're providing an uplift to counteract that downwards force. You can prevent ever getting prolapse, and you can certainly prevent a prolapse that you may already have from getting any worse. So you can avoid surgery. So to help prevent prolapse, avoiding being too overweight is important. Avoiding heavy lifting is very important. If you do some regular lifting, even of something light like 5 kilos, squeeze those pelvic floor muscles. Do the NAC as a prevention against prolapse and a prevention against leakage. Make sure that you're never constipated, and make sure you do not push it when you're at the toilet. And keeping yourself very well hydrated with water and eating a high fiber diet will help you with this. You can chat to a nurse or chat to a doctor if you're having constipation about how to treat it, because we want to avoid pushing at the toilet. Do the NAC if you cough or sneeze or laugh. And it can take a bit of practice to get the NAC going really well. For a sneeze or a cough, you may not have much notice. So when you think, oh, a sneeze is coming, then you squeeze the pelvic floor. Ka-choo! Okay, now I've stopped sneezing. Now I can relax the pelvic floor. You've got to start it before the sneeze, and you've got to hold it all the way through. So it takes a bit of practice. And you may not be doing much running or jumping or hopping or skipping, which is great. Why? Why do it if you don't need to? There's extra downwards forces of those types of exercise that are not great when it comes to wanting to avoid prolapse. But you can walk, you can swim, aqua aerobics, chair aerobics, tai chi, yoga, Pilates, all of these sorts of exercises that don't have that high impact pounding on your body are fantastic. And you can get a good workout from going for a vigorous walk or a swim or a walking in the pool. You can work your heart and lungs quite hard without any risk of prolapse. Cycling on a stationary bike is another good one. And lastly, keeping your pelvic floor muscles toned and strong so that you can do the knack very effectively is really good. So let's revisit that for one last time before we finish. Let's do another pelvic floor squeeze together. I'll talk you through it. So even as you're sitting there on your chair, or you might be standing, you can do it in either position. If you're sitting, make sure you sit tall so that you can feel that perineum area between your legs, the gusset area between your legs against the chair. So don't lean back on your tailbone, but sit tall. And remembering that pebble analogy I talked about in the first talk, here's a picture again. So remembering we're thinking ripples coming in, and that is the squeeze action of the pelvic floor, and the lifting up action of those pelvic floor muscles is like the pebble coming back up again in slow motion. So remember thinking the ripples are coming in, and then that pebble is now coming back up in slow motion. I'm squeezing around my vagina and my anus, or I'm squeezing around my anus and a feeling like I'm lifting my testicles if you're a man. And then a feeling like there's a lifting up happening inside of your pelvis, deep inside, a lifting up feeling. Like you're lifting that gusset area between your legs up off the chair. And in a moment, so just rest if you've been practicing, just have a rest now. In a moment, let's just go through one more time, and I'm going to count to see how long you can hold it. I'm going to count to 10. If you can do 10, that's wonderful. If you stop along the way, you know, maybe you get to 3 and you think, oh, I can't hold it any longer. Your number's 3. Maybe you get to 7 and you can't hold it any longer. Then your number's 7. If you get to 10, congratulations. I'll say stop because that's really good. So, are you ready? Thinking of ripples in, pebble up, and let's go. 1, 2, 3, 4, 5, up, 6, 7, lift, 8, 9, 10. Well done. And then let it come down again. Let the pebble come down. Let the ripples go out. Relax the pelvic floor muscles down completely. Now, there are several pelvic floor physiotherapists around in most towns around Australia. My clinic is the NT Physiotherapy clinic in Casuarina. My name's Paige Shreeve. If you're finding it difficult to contract the pelvic floor muscles, you're welcome to come and see me. If you are having leakage and you're struggling to get it under control, you're very welcome to come and see me. Or if you're having symptoms of prolapse that are causing leakage or causing a heaviness or a lump that's worrying you, you are very welcome to come and see me. You do not need a doctor's referral. If you see your GP to get an enhanced primary care plan, that is 5 free sessions paid for by Medicare. You can use them as part of your payment towards a physiotherapy pelvic floor assessment. This is not normal physiotherapy. The sessions go for longer. The first session with me goes for an hour. And for that reason, there's a little more cost involved. So there is a small gap to pay, but the EPC plan will cover a substantial amount of the fee if financial problem, if there's an issue there for you. So you could see your doctor to get an enhanced primary care plan or Medicare plan, EPC. Or you can just simply call the NT Physiotherapy Clinic, 8927 9334. It's been lovely to chat to you, and I do hope that I can get to meet you in person soon if we have another get together, or I may see you at some stage at the clinic. Okay, I hope you enjoyed. I hope you've learned something. Take care. Goodbye.
The bottom line is, pun intended, incontinence can happen to anyone, and it does happen to millions of people, yet many are ashamed or embarrassed to talk about it. Incontinence can often be cured or at least treated, and with the correct education and treatment, you can be managing independently or helping someone else manage independently. The first step is having a conversation with your health professional. At Southern Cross Care, we have the Darwin Community Hub. We have high quality services, including the Community Social Centre, Health and Wellness Centre, and in-home support services. The Social Centre is where community members can come and spend their day with like-minded others. The Health and Wellness Centre offers occupational therapy services as well as allied health run exercise. And in-home support services ranges from personal care, shopping assistance, and we've got a nurse on board as well. Our friendly Community Hub team is always happy to support your needs when and where you need them. So give us a call on 8946 1824. That's 8946 1824, or come and visit us at the Hub at 11 Waratah Crescent in Fanny Bay. I look forward to seeing or hearing from you soon. Thank you.